Okay, so the next topic is going to be herniated discs. The next question is, what is a cervical or lumbar herniated disc? A disc is relative to an intervertebral disc. What we say disc, shorthand, is an intervertebral disc. It's a soft structure that's supportive. It's got a very rigid, elastic band on the outside, soft material on the inside. This structure is in between two bones that provide us motion. It's a joint. It gives us polyaxial motion in all directions: compression, forward flexion, backwards, and rotation. So that disc structure is quite important. We have a lot of them, from the cervical, thoracic, lumbar spine. A herniated disc in any part of the spine is no different essentially. It's a deformation. It's an injury to that disc. There's a lot of ways discs can be injured. There's a lot of ways discs can herniate. In fact, you'll read all that on your radiology report. They'll say, oh no, there's 4 herniated discs stuck, and they're all on either side. What do I make of this? And that's where we come in. We want to walk you down that path and review that radiology and place significance to that imaging study, place context to it. So the herniated disc can take a lot of different sizes and shapes and form factors, but it is an injury to the disc, either the ring structure or the inside, where there's a bowing. There's a transition of that material on the inside to the outward, and it may bow out and push on the structures. Now, there's a lot of ways discs can herniate and they cause no symptoms whatsoever. The issue that we're focused on is identifying which nerves are being compressed due to that disc herniation, trying to understand where that patient exists on their pathophysiology, how the body normally recovers from a disc herniation. The majority of patients do. 8 to 9 out of 10 patients always recover and don't need any surgery whatsoever from their disc herniation. But at the end of the day, a disc herniation is an injury of some sort. It's a deformation and change in that anatomy. It can cause pain or cause nothing at all. And it's actually very contiguous, very similar to how we break down in the first place. These discs all collapse and shrink, they dehydrate, and then they settle down very eloquently without any symptoms whatsoever. So we wish to identify the ones that have run awry or have some pathophysiology, symptoms relatable to them, and then see what the next steps would be for that patient to see if they need treatment.